We're going to record today's session so that we can put it out there for others who weren't able to join us. It's going to be in English, and we are hoping that we can find a community member who's bilingual and is inspired by the topic to help us offer this same learning opportunity for the Spanish-speaking portion of our community. So at the end, there will be an evaluation, and if you have any ideas, you're welcome to put them into the evaluation or reach out to me. But that was the thought behind today's English-only training. Again, my name is Shannon Decker. I'm with an organization called the Speedy Foundation, which is a suicide prevention and mental health advocacy organization. We were established in 2011 in memory of a cousin that I lost to suicide. His nickname was Speedy, and he was on the U.S. ski team for about 16 years. And throughout that time, he spent a lot of time in his professional career in public light talking about adverse childhood experiences and mental health struggles. And so when we lost him, we realized that he really would have wanted us to continue to advocate and to share his story. And so locally in Truckee, Tahoe, we are the house of the Suicide Prevention Coalition. And we provide trainings, conversation, community outreach, and additional resources. And so today's training is really on how do we use a clinical tool at a level before a crisis, and how do we use our skills upstream before individuals really find themselves needing that clinical intervention in an emergency room setting, or in a legal type of intervention with law enforcement. So there's a lot of opportunities to think about the proven evidence-based strategies that we use for someone who's experiencing suicidal crisis before we get to that level. So I'm going to be sharing my screen and kind of transitioning back and forth between a couple different things. So I appreciate your patience with technology. We've got a couple videos, and then we're going to have some group discussion today. So in the hour that we have together, what I really want to focus on are what are those risk factors for crisis that could be impacting anyone across the lifespan in any community, but maybe specifically here. We're going to talk about protective factors. What are the things that we can do to help build protection? We don't have the ability to always change risk factors in someone's life, but we can build protective factors. We'll talk about some of the potential warning signs that someone's struggling. We're really going to focus on how do we express concern. And when we go into our breakout rooms, I want you guys to be practicing statements. Like, how would you phrase that if you really were talking to someone who was struggling? We will have a safety planning document that you'll all walk away with, and you can also order printed copies from us at no charge, as well as some other resources. So again, today's training is provided only in English, but we would love to offer this in Spanish in the future. And we don't have continuing education credits. We didn't get a request for those. So if you are interested in credits in the future for these types of trainings, please just reach out to let us know, and we'll start working to get that set up. What I would love for you guys to do is in the chat, if you could share with us your name, the location in which you are dialing in from today, and what is your role in the community? A lot of us have many roles in the community. We might be a member of a faith community. We might be a coach for a sports team. We might have a role as an educator or a healthcare worker. We might be a community advocate. We might be involved in a lot of civil organizations, or we might be a family member, an aunt, an uncle. So in the chat box, if you guys want to share that out so we can kind of get a read on who's here. The other thing that we're going to do, we're going to just start out with a couple business items. And I'm going to drop the business items in the chat. We've got demographics. So today's training is part of a grant that we have through Placer and Nevada County for suicide prevention. So I have a demographic link that I'm going to drop in. It's a Survey Monkey. It's not required, but it's encouraged. I would really, really encourage you to please share those demographics with us as part of our grant funding. But if you're uncomfortable with that, we understand it's optional. And then the other piece that we will be doing in just a couple minutes is a survey. So I'm just going to pull this link and jump back in here. All right. Let me take a look at the chat. All right, Rocklin, Deloro, from all over, Truckee, Tahoe Forest, awesome, Fresno, Carnelian Bay, awesome. Corinne is my counterpart in suicide prevention over in the Grass Valley area. Hi, Corinne. Awesome. Gateway Mountain Center, great. All kinds of folks are joining us today. Thank you. We've got therapists, a public health professional, a coach, County of Education, amazing. So we're all coming from different walks of life. And that's really, really powerful. September is Suicide Prevention Month, and there is truly so much that we can do to prevent suicide. It takes everyone. If we relied on mental health professionals to solve the suicide crisis, there is no way that we would make progress, because it's up to us to handle things at a much higher level before things escalate. We all have a role to play in suicide. So what I would love for you guys to do is take a couple minutes as I'm chatting to fill in those demographics throughout today's training. And then the other thing that I would like to have you do is I have a Google form, and I would love for you to take just a couple minutes to fill in some questions. And those questions are, what word comes to mind when you think of suicide? You can put in as many words as you can think of. What are the words when the word suicide is on the table? What words come to mind? And then on a scale of 1 to 5, how knowledgeable do you feel on the topic of suicide? And then are there any specific questions that you have on the topic of suicide that you want to discuss today? So you've got a little bit of homework while we launch into the beginning of this presentation. I am Shannon Decker. I'm based in Truckee, California, and my role is a suicide prevention advocate, a person with lived experience who's lost loved ones to suicide. I am an aunt, I am a godmother, and I am a regular at community trivia in our area. I would say those are my roles here. So the first thing that I want to share with you is some inspiration. I have a interview that I did with a friend down in San Diego, and she's going to share a little bit of her lived experience and how she has funneled that into a project called Find Your Anchor. Here we go. Hi, everyone. I'm Shannon Decker, the Executive Director and co-founder of the Speedy Foundation. And joining me is Allie. Allie is the founder of Find Your Anchor. I was back in Washington, D.C. several years ago with the American Association of Suicidology, and learning about all these advocates and all these amazing projects that were happening across the country. I was headed to Chicago, and I asked AAS, who do I need to meet in Chicago? And they said, you need to go talk to Allie, learn more about Find Your Anchor. And so Allie and I met for coffee, and the rest is history. So I'm excited to introduce you to Allie so that she can share more about her project, her story, her passion, and where she's at in suicide prevention. Hi, Allie.
Hi, Shannon. Oh, man, that feels like forever ago and not so long ago, huh?
Yeah. Like
Man,
yesterday.
like yesterday.
And you're not in
Absolutely
Chicago anymore.
not in Chicago. No, we fled the winter to warmer weather. So we're based in Southern California.
Awesome. So, Allie, we would love to hear a little bit more about your connection to suicide prevention work and how you came to found Find Your Anchor.
Yeah, absolutely. So Find Your Anchor really at its core is a grassroots movement aimed at suicide awareness and prevention. And we're all about these little blue boxes that we launch and send into the world. Inside, there's a whole bunch of resources and good vibes. Um, Poster, a letter, a deck of cards, 52 plus reasons to live, a please say pledge, a mixtape. We encourage people when they're in a better space to add to it things that help them, things that were anchors for them, and launch it, pay it forward for someone else in need. Um, I created Find Your Anchor because I've personally struggled, and I survived multiple attempts, and it was really just my journey navigating the mental health world felt very clinical and impersonal and just kind of corporate. And my first attempt was when I was in eighth grade, and my last was when I was 26. So I've known this system well, and there was really just this resounding feeling of this lack of humanity. And in some, like, one of the most important times in someone's life, when they're looking for reasons to stay, feeling like a statistic or a barcode being shuffled through a hospital system, wasn't it for me. And I figured I was not alone in that. So I'm a graphic designer. I was the design lead for the NHL Winter Classic and Stadium Series for years. And I was just like, man, I'm going to create what I wish I would have had. And infusing mental health with color, creativity, and really a personal touch. And so what started out really as my own way of healing, it was filling my soul to put these boxes into the world, has evolved into something so beyond me. We have over 65,000 boxes into the world and growing by the day. And because we encourage people to add to the box and pass it on, that's just 65,000 initial hands that they've touched. And I'm a firm believer that there's not a one size fits all solution to this and mental health. And what works for you may not work for me. And we're in a digital world, which is incredible for ease and access to resources. But maybe it's the graphic designer in me, but I'm like, print, we still have, print is not dead. And to be able to have, a tangible resource to send people, and to know that it's sitting on your shelf when you need it, can be so powerful. And it can be just those little things in life that get you through. And that's really how we define anchors, as those little joys in life. They don't have to be groundbreaking or obvious. They can be a caramel latte, it can be steak tacos, it can be a lazy Sunday, a long weekend. One of my favorites, Sister Act 2, Princess Diaries. Like, if I'm having a bad day, I want to lay on the sofa, order Chinese food, and watch Sister Act 2. It's not solving my problems, but it just gets you through another night, another hour. And sometimes that's all you need. And it's stringing those little moments of joy along to get you through some of those darker times. And we're really just all about this community of strangers who care. In the height of my struggling, my core belief was that no one would care. I couldn't feel the love and support that I really was surrounded by. And I thought, if I could create something that showed you that strangers care about you, maybe it won't be so hard to believe that your friends and family do as well. So we're all about those little moments of kindness, those small acts that can have truly profound effects from someone you may never meet. But it's just trying to put more love into the world, Shannon. That's in a nutshell, in a large nutshell.
Yeah,
Find your anchor.
I love it. The Speedy Foundation is happily partnered with Find Your Anchor. We incorporate the Find Your Anchor boxes into the care kits that we send out for those who are struggling. You can order them on our website. You can go to Find Your Anchor to order them. We just encourage that if you're struggling, take a look at the box, and see if there's something that anchors you to hope. If you know someone who's struggling, it's a great, gift to give them, or, something to leave in their path so that they'll come up across it, or take them into your community and distribute them in places where you have no idea, if somebody who's struggling will come across. But if it's a place that's meaningful to you, it might be meaningful to them. I have another question. The Speedy Foundation has done a lot of work in elite athletics, in trying to destigmatize the topic of mental health, the spectrum of mental health, mental illness, and the topic of suicide prevention. And you yourself have been involved in some elite athletics, and there's some, really powerful partnerships that you have with Find Your Anchor. Could you share a little bit of information about that with us?
Yeah, absolutely. I mean, this is the year of sports for Find Your Anchor. We've partnered with a handful of pro teams. The 49ers have been very, very good to us. We've partnered with them 4 or 5 times now and done box building events with staff and players. George Kittle's handwriting a note to someone in the Bay Area struggling, packs her box up, adds the shipping label on, and it goes in the mail right to her. So that's been really cool to see these teams and players really step up. We've partnered with the Lakers, the Minnesota Vikings, the Indianapolis Colts, and growing. So it's been really cool to have these athletes really step up and shift conversations. When a linebacker's telling the world and telling his fans that he struggles and seeks help and asks for help when he needs it, like that resonates with people. And I'm just so grateful that more of these athletes are using their voices and really helping normalize these conversations.
Yeah. Find Your Anchor has been amazing in getting to that high level. We always talk about how suicide prevention really is a grassroots as well as a tops down. Like the only way that we can bring about change is from the bottom and the top meeting in the middle. So thank you for the work that you're doing there. I know that during COVID, you guys launched an amazing campaign with Lady Gaga's Born This Way Foundation, and there were billboards in very prominent places. I saw stuff in Times Square in New York. So my hat is off to you. I am so empowered and inspired by you, and I'm just happy to call you my friend.
I mean, likewise, Shannon, right back at you.
Thank you. All right, so I share with you Allie and her project as a resource, but also as inspiration. Perhaps you or someone that you love has struggled and they've needed something. Maybe it's tangible, maybe it was words, maybe it was something else, something abstract. But I want you guys to kind of think about, is there a need for a Find Your Anchor box, or is there a need for some other type of resource for someone that you know, or a place in your community? I know that you guys have been filling out demographics and that survey, which I appreciate. We have one more quick video on the Find Your Anchor box itself, and then we will come back together to have a quick chat.
Maybe you've read about this. Maybe you didn't have to read about it because it's already hit too close to home. But you should know the world is suffering from an epidemic of suicide. In the United States alone, the number of people taking their own lives has increased 25% since 1999. Globally, this epidemic cost us almost 800,000 of our mothers, brothers, spouses, children, heroes, and fellow humans every year. And each one of those people had their own story. But there's a consistent theme I've heard over and over. A feeling of being alone and unseen in the middle of an increasingly distracted and disconnected society. Stories about standing in a park or on a bridge, just waiting for someone to say hello. For just one smile from a stranger to prove to themselves that their existence matters. When you're suffering, it can really be something that small. Acknowledge me, smile at me, and I won't kill myself. What they need is something to grab onto, something to hold themselves in place. That's why I created Find Your Anchor. It's not a program or a hotline. It's something real you can hold in your hand. And inside are items designed to give hope, validation, and maybe a smile to the person who finds it. A letter, a poster, a deck of cards full of ideas and experiences that help anchor us to our lives. We launch these boxes into the world one at a time. People in need find them and take them home. They keep them as long as they like. When they're ready, they add something of their own to the box and launch it for someone else to find. So far, we've launched thousands of boxes in every state and over 35 countries. We've established partnerships with other groups dedicated to suicide prevention, and we've created custom blue boxes for partners in the military and education. We want a box on every college campus, on the desk of every congressperson, and in the hands of every veteran who suffers from suicidal thoughts. And you can help. A $25 donation covers the printing, materials, and assembly of one box. And we are looking for additional partnerships to help expand our mission of helping people establish an anchor, a dependable, stable, secure base they can hold on to, no matter what storms may come. Our world is full of big problems. An epidemic of hopelessness is among the biggest. I don't know how to make it go away, but I know these boxes help. All by themselves, they're quite small, but they open up to reveal something huge, and perhaps the only thing with the power to make a real difference: humanity. Thank you.
Okay. All right. So I want to take a moment to check in and see, how does this resource land? Is it hitting home? Are there other components of resources or caregiving that you're kind of drawing a connection to? Anybody, you're welcome to drop notes into the chat, or I welcome you to take yourself off of mute and just kind of share out with the group if there's any connections that you're seeing.
Sorry, could you repeat that again? Just try to find connections between the anchor box and
your own personal experience. No.
I guess speaking for myself, I have a friend who has struggled with depression and suicidal ideation. And I think that it's a really nice idea. I don't think I've ever thought of that, but even something like a concert, like, yeah, I mean, I held out because I have a concert to go to, or like I'm trying to wait for the finale of a show. So I think that this is a really wonderful idea. I've never heard of it, but it's really cool and inspiring.
Awesome. Thank you for sharing that. It looks like we've got someone who responded, really inspired by this resource. Thank you. Okay.
I really resonated with the idea how they mentioned that it's not meant to solve your problems. Like, this isn't a box that's going to solve your problems, but it is something that is a tool that can help you feel better, so that maybe you can move on and put in some work to solve your problems. But I just really like the acknowledgement that it can be really small things that can be really impactful.
Thank you, Stephanie.
I love the name, Find Your Anchor. I mean, it's such an invitation and it's so positive. It's really saying that you do have an anchor and you can find it, and that you'll have some companionship and support in doing that.
Thank you, Claire. Yeah. That power, what anchors you to life? What are your connections to this life? And for a lot of us, it might be a family member, it might be a friend, it could be a pet. But there's also very complicated relationships that we have with that. And so what's powerful about this box is that Allie has really spent a lot of time thinking about inanimate objects and places and ideas, because those are other connections that we really can focus on in times of struggling. When she met with us last May at the community collaborative meeting in Truckee, she had shared how one thing that brought her hope in her darkest moments, when she was alone in a hospital bed after a suicide attempt, was that she had a clean pair of underwear, and that was hope for her. Like, it's those simple things. It could be Sister Act, it could be a clean pair of undies, it could be remembering your very first car, it could be remembering your favorite meal, your favorite place to be. So we need to help those who are struggling to find those pieces of connection.
I think, can I say something?
Please.
I think one of the things you guys hit on was is joy, you know, and I think that those box is that little package of just love in a shell that people can like actually hold on to, because a lot of times, you know, they don't have anything, you know, or they and have this thought that they don't have anything, and so it's literally, you know, love in that format, that brings the joy of lifting something. It's kind of like that joy we get when, like, when the Amazon package, you know, shows to your doorstep. You're like, it's like, oh my gosh, it's Christmas, you know. And that's like what that box represents to somebody who finds it in need, is something of belonging, in which they can unpack and then, you know, take a look at that, and then maybe they might be attached to something, that one thing in there, or maybe it might be an idea of something that they enjoy, or it opens up that door to see what you love, you know. So that's what I took from that, from those boxes.
Thank you, Dominic. Beautiful. Yeah. I am looking through the survey that you guys just took, and the first question was, what words come to mind when you think of the word suicide? And these words aren't joy. It's loss, it's grief, it's heartbreak, it's death, it's hopelessness, it's struggle, it's giving up, it's sadness, despair, desperation, heartbreak, pain, loneliness, discouraged. These are the heavy moments. And as humans, it's natural for us to experience these from time to time. It's when we get stuck in these places, when we feel like we have unsolvable problems or we have unbearable pain. That's really what creates that desire for suicide. So thank you for painting a picture of what that looks like. It's not that joyful piece, but that's something that we can help to build. We can build in these protective factors. We can build in joy with the people that we know, that we work with, that live in our communities. For people that we've really never come into contact with, we can put it out there into the world. And in looking at our comfort level on a scale of 1 to 5, it looks like people are kind of all over the board. Some are comfortable down the middle. We've got responses all over. So what I would recommend is, if you found yourself in the 1 to 2 range, I really encourage you to take a gatekeeper training. We have some that I will forward along after this meeting. But a gatekeeper training is going to teach you to recognize the warning signs, the risk factors, and how to start a conversation. Our short hour today isn't enough time to dive into everything. We're going to be talking about really high level pieces. And for those who do feel comfortable with this topic, you know, thank you. I feel like you must have done a lot of pre-work to get to that place. It's not necessarily something that everyone is just born with. So it does take a lot of work, a lot of conversations, a lot of asking questions and thinking about this not so sexy topic to get that way, to get to that place. Edie said, how do you suggest we might connect someone with this resource? That is a great question. I'm going to send you some links after we hop off here to order a Find Your Anchor box, and I'm going to share with you a couple other resources. So it looks like my settings are a little bit silly, and they are showing you the controls. So I apologize. If at any time my screen is not conducive to hearing or seeing things properly, please unmute yourself and just shout it out. I'm not able to see the chat while I'm sharing my screen for some reason today, so I apologize. We'll jump back in here, and we're going to talk about some additional resources and how to start that conversation. So one of my favorite campaigns is Are You Okay? We have these little Are You Okay cards that you're welcome to order from our website, and we can get them shipped out to you. You can download them, or you can go visit areyouok.org.au. This is a campaign that comes from Australia. It is a private-public partnership between the government of Australia and the activists of Australia. And the whole idea here is that we need to really start checking in on our mates. We need to check in on our friends and our family so that we can have these difficult conversations. We can pierce that uncomfortable awkwardness, because unless we do, we continue to suffer in silence and we end up in crisis. So the Are You OK campaign is really formulated on sharing awareness and education on how to ask direct questions that can be uncomfortable, how to listen non-judgmentally and empathetically, how to encourage action, because ourselves, we're not going to be able to save someone else. We can't make them want to live. We can't help them see how amazing they are. What we can do is we can encourage them to start to see how amazing they are. We can encourage them to find the anchors that exist in life. And then we can check in. It's not just a one and done type thing, unless it's a complete stranger and we'll never see them again. But if they are a person that we know or we have the opportunity to check in, that is a vital piece of this work. And so some of the tips in starting these conversations is to try to be relaxed. And if the topic of suicide, if the topic of a mental health crisis or a substance use crisis gives you anxiety, we need to do more work around that so that we can be more comfortable and have a more friendly approach to addressing this. Asking them questions where it invites them to open up, like, how are you? How are you doing? What's been happening? You can also provide examples of the things that are concerning to you. You want to be able to state them in a non-judgmental way. So by saying things like, I've noticed that you don't text me memes as much as you used to. I've noticed that you don't sit with me at lunch. I've noticed that you're dashing off before church ends and we're not, laughing in the parking lot anymore. I'm concerned what's going on. Those are statements that can help to state facts without the person becoming defensive. And then we need to practice really good listening skills. A lot of you stated that you've got some roles in the community from public health or from some of those professional settings where you've probably had a lot of experience with listening, and that maybe being a natural listener is something that you're good at. Listening in a non-judgmental way can be much more difficult when it's a family member or a close friend who's been struggling, especially if they've been struggling for a long time. And so sometimes we just need to remember to have extra empathy with those individuals. We need to work on dropping judgment at the door and acknowledging the experience that they're willing to share. Sitting in silence is a thing that as Americans, we really struggle with. So if we can practice being with someone in an emotionally vulnerable state and not sharing every single thought that you have or trying to fix the problem, that can be really beneficial. We want to encourage them to take action for themselves. You can support them. You can offer support. How would you like me to support you? What have you done in the past to manage a similar situation? These are great ways to frame how you can assist. But we have to remember that we can't solve someone's emotional pain. We can be there to support them, and we can help them initiate ideas that resonate with them. We can be really positive about the role of professionals, but we also know that professionals don't solve these problems either. They can be part of the solution. And then checking in. So one thing that I have shared is setting reminders on my calendar. Sometimes when someone's in crisis and we get through that initial crisis, it's such a relief that it might just fall off your radar. But if I set a calendar reminder for 2 weeks and then a month and then 2.5 months and then 5 months that just says, Sally. And then I remember Sally had a really hard time a couple months back. I just want to check in. I just want to see how things are going. It doesn't mean that you have to make a big whoop-de-doo about it, but it helps them just to remember that they feel seen and that they are on your mind. So that is a campaign that I think is really beneficial to many folks, and it's been invaluable to me, and it might be invaluable to you. The other thing that I want to spend the rest of our time on here today is, oh, I'm pulling up the wrong thing, is this safety plan. And so I have a little revised version of this safety plan. The English has been revised, but the Spanish has not been updated yet. So in this one PDF that has been dropped into the chat box, it's going to walk through the clinical safety plan modified for a layperson approach. So the safety plan, we're going to have a quick video from the creator of that, but it's an evidence-based intervention for someone who has had a suicide attempt. And what I am proposing is that we start to look at the safety plan in an upstream means as a template to have some very important conversations. So it's in your chat. It's also available to download or to order printed copies on our website, and we'll send the link to that here in just a little bit. So we're going to hear from the creator of the safety plan next.
The safety planning intervention is an intervention that my colleague Gregory Brown from the University of Pennsylvania and I developed. We originally developed in it as it is now in its current form. We originally developed it for a treatment study that we were doing in suicidal adolescents. We developed this intervention as a way to help keep these suicidal adolescents safe until they got the cognitive behavior therapy that we were delivering to them. And so we just thought of it as a kind of a management technique. And it turned out that in and of itself, it was a very powerful intervention. The safety plan is actually simply that. It's a safety plan. It's a suicidal person's emergency plan. We know from a lot of research and from talking with people who grapple with suicidal feelings that being suicidal is not an all or none phenomenon, that suicidal feelings come and go. And we also know that if somebody resists making a suicide attempt, that they don't necessarily have to go on and make a suicide attempt later, that the urges can dissipate. And so the safety plan is something that we have developed that helps people cope when they're entering that acute suicidal state and gives them something else to do instead of engaging in suicidal behavior.
All right. So if we know that it works with somebody at the lowest moment of their life, then it must work for them as they're struggling before they get to that lowest moment in life. These are some of the resources that we have. Know the Signs is California's suicide prevention campaign. We really encourage folks to become more familiar with what some of those major warning signs are. Some of the warning signs of somebody who might attempt suicide are vast, and one slide wouldn't be enough, let alone 20 minutes. The signs are various, but what I want you to do is I want you to think of yourself as a smoke detector. And when you start to get the signs that somebody isn't doing well, that they're struggling with their mental health, with their emotional well-being, or with substance use, your smoke detector starts going off. Some of the very common signs are they're talking about it, either directly or indirectly. They might be suffering with the way that they sleep, sleeping too much or not sleeping enough. They might be having trouble eating. They're not eating at all. They might be using substances more. They might be preoccupied with means of how to end their life, maybe a fascination with guns or stockpiling pills. These are the signs that are cues, and it starts to send the smoke detector off in our body. And so then what we need to do is we need to come up with a way to find the words. And that can be really difficult, especially if we aren't trained in it, we haven't had experience with it. We need to be able to say things directly like, have you had thoughts of suicide? Are you thinking about ending your life? This is another great time to talk about the stigmatization of mental health. In the world of suicide prevention, we've walked away from the term committed suicide because it has a connotation of committing sins and committing crimes. And so finding the words and being comfortable with the words that are going to share hope is really what we need to think about. And then we need to reach out. We need to be able to reach out and help somebody connect to hope. It might be by providing them a Find Your Anchor box. It might be giving them a resource, or taking them out to lunch. It might be taking them to an emergency department if they are in an active suicide attempt. It might be sitting with them in silence. So reaching out is powerful, and it's going to be different depending on your relationship with them and where they're at in their crisis. And then there's self-care, and there's resilience, and there's building protective factors. And so things like learning breathing techniques, practicing good social media and technology hygiene, ways that we can take care of ourselves, and we can model that and share that with others. And then there's two resources that are really powerful as far as crisis in our communities right now. We've got a very big epidemic happening with the opioid crisis. And so knowing how to respond to an opioid crisis or another substance use crisis, as well as the resource of 988, are two very powerful pieces. So 988 is our National Suicide and Crisis Lifeline number. It went live last July, and it's a number that you can call, text, or chat. It's available in English and Spanish. When you call, it'll say press 1 for the Veterans Crisis Line. It'll say press 2 for Spanish, and it'll say press 3 for an LGBTQ plus specialty. And they've established a partnership, a pilot program with the Trevor Project, which is an incredible organization to support our youth and young adults who are struggling with issues surrounding LGBTQ plus problems, stigma, or just issues. So knowing about those resources, programming 988 into your phone so that it is even more accessible for somebody who's struggling, to be able to share that as a contact, to be able to call it and say, you know what, I don't even know which questions to ask. What we should do is let's call 988. We'll put them on speakerphone and we'll let them guide this conversation. That's, one way that you can utilize that resource. But if you are familiar with this safety plan, you will have the words. You will know what to say. You will know what to ask. So some of the major risk factors that are out there, there's the individual risk factors that a person could be experiencing crisis. And these are the things where if we're aware of them and we're comfortable talking about them, we can help to de-escalate a crisis. If they've had a previous suicide attempt, that is a major sign. It does not mean that they're going to go on to end their life, as Dr. Stanley was saying. It means that they're at a heightened risk, and we need to be more aware of it. If they have a history of a mental illness, such as depression, that is a risk factor. But we also know that people who end their lives don't all necessarily have a diagnosable mental health condition. Sometimes people end their life because they have unbearable emotional pain, or they feel like they have some type of unsolvable problem. And that does not necessarily mean that they have a mental illness. They might have serious chronic pain, legal problems, financial problems. They might be very impulsive or aggressive. They could have accelerated substance use, adverse childhood experiences, a sense of hopelessness. The list goes on. Relationship risk factors are another piece. So if someone has been bullied, if they've lost someone to suicide, that is an increased risk. Whether it's someone that they knew personally or someone that they just admired and looked up to. So suicide contagion and suicide clusters are a major risk factor once someone has been lost. And that isn't necessarily time bound. It could happen over a long period of time. We see that in our tribal communities often. A loss of relationships, social isolation, and conflict are some of those relationship risk factors. The video for Find Your Anchor went into this epidemic of loneliness and isolation, and that video was done before COVID. COVID has exacerbated that, but at the same time, maybe the silver lining of COVID is that funding and the stigma surrounding that has been lifted to some degree, and we can talk about it more openly. The Surgeon General has released papers and resources to address the need to address social isolation. So those are some big pieces. As far as community risk factors, a lack of access to healthcare, a cluster of death by suicide, stress, community violence, historical trauma, and discrimination are all major risk factors for someone, not just at risk for suicide, but at risk for some type of a mental health crisis. Stigma associated with seeking help is a societal risk factor. Easy access to lethal means, especially firearms, and then unsafe media portrayals of suicide are all big societal risks. And in exciting news, the White House just announced that they are establishing an office of firearms so that we can start to really tackle not just suicide by firearms, but all violent deaths. All right. So what I want to do, I'm going to do a time check. We've got about 10 minutes left together. So I want to break up into some rooms. And when we go to the rooms, I want to have a conversation. We don't have facilitators identified. What I want to have is a really high level conversation of how can we take this personal safety plan and some of the wording that's in here. Like, I know something's wrong when I feel this way. Some of the personal coping strategies that take my mind off of things. If we were to start to phrase this, sterile safety plan into a more layperson approach, like these are the places and the people that I can go to. Here's my go-to folks. Here's when I know it's time to call the pros. And who are the pros that I have within my reach? Who are the pros that I can handle for lower level crisis versus high level crisis? Because we know that following an emergency room visit or interactions with law enforcement, a person who is at risk of suicide is more at risk for suicide. That is not the solution either. We might need to use those as interventions. There might be somebody who has already activated a suicide attempt and they might need an ER visit. But for somebody who's just struggling with suicidal ideation, locking them up in an emergency room where they're sitting in a sterile environment is really not going to be beneficial. And yet for so long, that is how we handled that. What things do we need to do to make my environment safe? If there is a firearm, do we need to lock it up? Do we need to limit access until things improve? Should we remove it from the home? And when things start to get better, we'll bring it back. And then let's think about what are the anchors for me in life? What are my reasons for living? So Christina's going to whisk us away into some random breakout rooms. And if you need anything, I want you to just ping for help. There is a thing to call the moderator back, and I will pop into your breakout room. But this, I'm going to put that question right here in the chat so that you guys can talk amongst yourselves. But what would you do if you had a friend that were facing some of these issues? Is there a way to use this safety plan? Are there any questions before Christina magically sends you away? All right. Enjoy your brief conversation. We'll see you in about 5 minutes.
Good job, Shannon.
Thank you. What do you think?
Good. Yeah, you're doing great.
Okay.
I should have offered to share your slides for you. I'm so sorry, or at least put things in the chat.
No. I know. I should have maybe sent that to you ahead of time. My computer just has some weird settings. I had a mishap with an interview on Zoom, and then I've been in customer service with Zoom trying to restore it, and they had me change all my settings, so it's just a little wacky.
Yeah. Oh no, you're doing great. It was absolutely fine. Yeah, I think you can join any room that you want.
Okay. So
Hold
I'm
on.
gonna go pop around,
Okay.
and then if somebody comes here and needs something, feel free to text me, or you should be able to find me in a room and whisk me out.
Yes. Yeah, I can see. And so you said 5 minutes, which was about a minute ago. So bring them back at
Yeah.
12:57.
50. Yeah, let's do 57.
57. Okay.
Okay.
Great.
Thank you.
Thanks.
Breakout
Mhm.
rooms. Okay.
Can you talk again? I didn't hear you. I can't hear you.
Oh, sorry, I muted
Now I
myself.
can. Okay. They have 15 more seconds.
Okay. All right. Welcome back. Does anybody have any, I know we're right on the edge of time. Is there anybody who wanted to share out? Was there any conversation that was really beneficial? I was popping in and out of rooms and I heard some good examples. I know it was a really brief conversation. The first time we ran this training, we had 90 minutes and we were all sitting at tables looking in each other's eyes, and we just had more time to dive into it. So I apologize we didn't have a lot of time for conversation. If this is a topic that you want to talk more on, you're always welcome to reach out to me. We can talk one-on-one. If there was anything that was really heavy or concerning for you, please talk to someone that you trust and that you care about. You can always reach out to 988 as a confidential, non-judgmental listening ear. You don't have to have thoughts of suicide to call them. You don't have to be in an active crisis. Like if you're looking for for support, 988 is another great one. And we can always, come back together and take this to another level. I'd love to be able to take this resource and share it with the Spanish-speaking community. So if that's something that you have connections into, I would love to talk more about it. In the chat, I just put in the link to the evaluation. Would love your help in getting the evaluation, your demographics, just for our grant pieces. But the most important thing is that you are here and that we're part of this conversation. I am going to send out links for the Find Your Anchor boxes, for ordering supplies, ordering safety plans. Safety plans can, come on little tear-off sheets of paper. There's apps for safety plans. We've got a page on a website that kind of walks through more of the historical pieces and the clinical safety planning piece. We've got a question from Monique. There are further trainings. I don't have anything scheduled at this time, but we will continue to build them and provide them. I have some online on-demand trainings. I'm going to put a link to our training center. We're adding to this more and more every day. I will be taking this training and creating it as an asynchronous learning opportunity. So what's available right now at no cost is QPR, which is a suicide prevention gatekeeper training. There's the opioid overdose prevention training through Nevada County. We have a red flag recognition training to prevent school shootings or active shootings. We know that active shooters are suicidal before they become homicidal. So learning to prevent suicide is one of the ways that we can also prevent mass homicide. And then counseling on access to lethal means is another amazing training. Some of these are hosted through the Speedy Foundation, and sometimes they are redirected outside. We have a training that will launch either today or on Monday called Safe Messaging, which is suicide prevention messaging for for journalists and folks in the media. And we'll have a Know the Signs suicide prevention training launching soon as well. You guys had a lot of amazing questions in the survey that we started in the beginning, and we didn't have time to address all the questions. So the email that will follow up from your registration will have links to resources, and there will also be answers to those questions. So I know that we didn't have time to cover everything, but I appreciate you guys sharing out about what you're interested in. And if I start to see that there are some common threads, maybe we can build a training that's specific to those questions. And so we're over time, and I apologize, but if you need to drop off, feel free. Otherwise, I'm happy to stay here and continue to answer any questions that you have.
Great. Thank you so much, Shannon.
Thanks, Monique.
Thank you.
Thanks,
Bye.
Melanie. Thanks, Corinne.
Thank you.
Thank you. Awesome. Thank you. Bye, Lizzie.
Thank you.
Thank you. Have a good one.
You too.
All right. Well, Christina, we can probably stop recording.